Yeah. Okay. Bismillah. I'm talking up here about drugs first. Why do drugs happen? First of all, what I mean by a drag, I mean that the material has been dragged away from the tooth and it did not capture the marginal gingiva around the tooth. Okay, so if it doesn't capture the marginal gingiva, that means I don't have an accurate impression of the finish line if it was a finish line procedure. Or even in polyvinyl siloxane it's present. Okay, drags happen in all impression material, even in alginate, where the impression material is not taking full anatomy around the teeth or finish lines or around occlusion, whatever. So we have a drag. So this is one of the areas of drag. This is an area of deficiency. Here it's a bubble, but here it's a drag. See how it's dragged away? Sometimes you even find these lines going like this. Even the track that the tooth went by is apparent. You will find it like grooves in the material. So that's a drag. What are the reasons for this? One reason for this is that the material might be insufficient, for example. If it was not, if it was insufficient, that means I don't have enough hydraulic pressure in the tray. So it's not pushing the material. The tray is not pushing the material towards the tooth because it's deficient. The material is deficient. So either it appears as a bubble or it appears as a drag. Okay. So in having not enough material, or exerting quick pressure, and the material was partially set outside the mouth. I mixed it. I was slow in my mixing. I put it in the tray. I was going in while the material has already began the setting reaction. That means part of it has already been solidifying inside. Although I see it flowable or I see it playable with my hands, but actually some of its flow has been reduced because some of it has accumulated and aggregated in the polymerization reaction. So it already had been becoming solid, partially solid. So it will drag, it will not flow. What will happen if it's partially set? The rheological factors and the properties of the material. How does it flow around the tooth? It will be reduced. It will not flow. It will actually be tearing the material as if you're making micro tears. So this is one of the reasons. Another reason is incorrect mixing of the catalyst and the base. You will have the material you will reduce the flow possibilities of this. Also, one of the reasons of drugs is moving the tray during the setting. You were not stable in the mouth, so you'll have like a drag or a space that the material is not fit on the tooth exactly. So these are the reasons of the drags. I wanted to show you them and what will happen if it's a crown. You will not take the finish line correctly. If it was temporary, you will spend a lot of time removing these excess material away. So make the correct impression rather than correcting the procedure later on.